Hey guys, this is Keith and you're watching the Unbroken Pelvis channel. Today we're going to take a look at how to properly both expand and relax the pelvic floor. And if you deal with a tight pelvic floor, even if it's tight right now, I promise you, you're not going to want to miss this video. So stick around. But first, it's disclaimer time. I'm not a doctor, but I am here to offer information that's a little bit more trustworthy than, say, your average government spending program. Take what I say with a grain of salt and always consult with a medical professional. So in my last video, I covered the 3 things that helped me begin my journey to recover from pelvic floor dysfunction. The first one is engage my core. The second one is activate and tighten my glutes. And then the last part, which was the trickiest part, is how to drop the pelvic floor while you're doing that.
Drop it like it's hot. Whoa!
Now, that particular 3 things that I did, I'm just going to call it the trifecta. That was a neuromuscular re-education exercise. It's not to be confused with actually strengthening my core and my glutes, although the trifecta is something that helped strengthen my core and strengthen my glutes. But my core and my glutes were pretty weak. And one of the most challenging things to do with the trifecta was actually the last part, and that is to learn to drop my pelvic floor. And it wasn't until several weeks after beginning my therapy that I finally learned how to do that. And today I'm going to share with you the principles on how to do that. And there's 2 parts to it. They're both considered a reverse kegel, but the first part is diaphragmatic breathing, learning to breathe into the diaphragm to create 360-degree expansion, as I explained in the last video. And the second part is actually dropping the pelvic floor or dropping the rectum. Now, this is something that we all actually do every single day. A lot of guys say, Keith, I don't know how to relax my pelvic floor. It's so tight. I don't know what to do. But the fact is that, since you were a child and you've been going to the bathroom, urinating, going number 2, you are actually, every time you do that, you are performing a reverse kegel. Now, whether or not you're properly diaphragmatic breathing or not, or whether or not your reverse kegels are effective, and that's, by the way, one of the reasons that we have difficulty emptying our bladder and also defecating, is because we're not properly reverse kegling. But I promise you, if you use the restroom every day, and everyone is using the restroom every day, unless you have a colostomy bag or a catheter, you know how to reverse kegel. And so we're going to talk about the moving parts of a reverse kegel. So come with me to the other room and let's get started.
So I like to think of reverse kegels as being a 2-part process. The first part is the relaxation and expansion or elongation of the muscles in the pelvic floor. And the second is diaphragmatic breathing, or deep belly breathing, if you will, where the abdomen, the cavity in the abdomen is expanding 360 degrees all the way around. It's not breathing heavy in the chest. It's breathing into the belly and into the pelvis. So let's talk about the first part, the relaxation and elongation and descension of the muscles in the structure of the pelvic bowl. As I mentioned in this video as well, this is something that everybody does. You've been doing it since you were a kid. Every time you pee, every time you go number 2, every time you go to, for lack of a better description, pass wind, like you have one in the chamber and you're trying to see if you can let it pass silently without bearing down, without forcing it, you are opening up the muscles in the bottom of the pelvis and allowing the muscles to elongate and stretch downward. And you can confirm this with your hand over the area of your rectum. You will actually feel, when you're doing it properly, you're feeling it expand outward and downward. This is a on-command thing that you can do with practice. Now, those with a hypertonic pelvic floor sometimes struggle to make that neuromuscular connection down there because everything is tight and it's locked up. And so this is an exercise that you can practice at any time during the day. And so if you would humor me for a moment and just imagine that you are trying to open things up and pass wind, and I'm doing it right now. Don't worry, nothing came out. Nothing has to come out. You don't have to have something in the chamber, but it is something that you can feel the pelvic muscles descend. The second part of that is diaphragmatic breathing or expansion, as I mentioned earlier. And so if you would humor me again, if you're sitting down, go ahead and stand up And let's try to practice putting these two things together. So as mentioned in my first video on how to stabilize the pelvic floor, you're going to do the sandwich drill. So you're going to take your hands like you're eating a big sandwich, and you're going to put them around your core just like this. And then we're going to take a big, deep belly breath and allow the air to expand our core 360 degrees. And you should feel the expansion in the tips of your fingers. So if you watch my fingers as you do it with me, you'll see that they expand as soon as we take a big belly breath. Ready? And we're just letting the air fill our core with our diaphragm. And now we can put those two things together where we're allowing the pelvic floor to descend, those muscles to elongate as we take a deep breath. And theoretically, the air inside the abdomen should also be descending downward into the pelvis. And if you're having a hard time visualizing what I mean by allowing the air to go down there, I've got a little demonstration here. So this balloon represents the abdominal cavity when you take a diaphragmatic breath. And as you can see, as it fills with air, it expands outward. Okay. But now imagine that this balloon is also able to descend into the lower part of your pelvis. And so as you take that breath, you can see the balloon expand downward. Look, I know what that looks like. Let's keep it clean, okay? And so as you take that breath, you can visualize that air is moving downward into the lower part of your pelvis. And so that goes along with when you're relaxing the lower part of your pelvis, as you fill with air, you're allowing that air to go downward. So this essentially is a reverse Kegel. It's something that you could practice at any time during the day. You don't have to hold it for a minute or 30 seconds. You can just do 4 or 5 seconds, and you just want to be able to feel that expand every time you take a breath. And that's going to help relax those muscles. It's going to help elongate and stretch those muscles just a little bit. It's not something you have to force. It's not something that should cause pain. It should just be a relaxation and allowing the air to move downwards into the pelvis.
Okay, so as we discussed, the two parts are expanding 360 degrees around your abdomen and then lowering that down into the pelvis. And the second part is letting that rectum drop on down. And you can actually take this and practice it on the toilet. You can go ahead and do it right now if you want. I'm not watching. You're watching me. I'm not watching you. So you're going to sit down on the toilet. You're going to take your hand. You're going to place it gently over the rectum. And as you perform this, you should feel your rectum just slightly expand, drop down a little bit, even pucker out like good old duck lips. And this is something that you can practice just like the trifecta. You can practice this at any time during the day. Now, when performing a reverse Kegel, you don't need to go crazy with it.
Don't go crazy.
You don't really need to do it for, a minute or 2 minutes or 3 minutes.
24 hours.
You can just do it for 5 seconds, 10 seconds, 15 seconds. It's not an exercise as much as it is neuromuscular re-education. You're retraining the muscles down there to learn to say, hey, it's okay to relax. It's okay to expand. It's more of a gentle stretching. I'm going to tell you what it is not. It is not a bearing down. You don't need to be trying to pass gas or pass stool. This is simply just something that you are doing to help expand and relax those muscles. And with enough practice, you can actually get better at it. So don't be discouraged if you're having a hard time making that connection. This is something that you can practice every day. Now I'm going to give you one more tip. And this tip comes with a story. So when I first was suffering with pelvic floor dysfunction, I was being visited by my pelvic floor physical therapist, really sweet lady. Her name was Lisa. She came to the house and, she did some internal work on me with her fingers. And then eventually she told me to purchase I think it's an Intimate Rose vibrating pelvic wand. And so I purchased it. She showed me how to use it. And basically you would insert it and you would move it around a little bit very gently, kind of pinning and stretching some of the muscles in the levator ani. If you haven't performed internal work, I highly suggest you have a pelvic floor physical therapist show you how. However, I will be making another video on that in the future. That being said, I would always go in with the wand. And I had a really hard time, it was a pain. Because you'd have to, get the lube and get the wand and lay out a towel. And it was a whole big rigmarole, and it would take like 10 or 15 minutes to get everything set up and then perform the internal work and then the cleanup afterwards. And it was a hassle. So one day I was about to use the restroom, and I realized that I was in a lot of pain. And I figured, you know what? It's been about a week since I've done some internal work. I have a glove and I have some lube in the cabinet here. And so instead of getting the wand, I just figured I would use my finger. And so I get in the squatted position on the floor, and I lube the finger up, I insert it rectally, and I was very surprised. It was honestly my first time sticking my finger up there. Wasn't in the habit of doing that. And so I noticed one thing right off the bat was that it was exceptionally tight. And I always had a hard time getting the wand in there by itself, but this was different. Even though my finger is a lot skinnier than the wand, it was exceptionally tight. And so, you know, I had sort of known a little bit about how to perform a reverse Kegel, but I wasn't very good at it. And this was a game changer. With my finger inside the rectum, I was able to sense how tight it was. And so I then performed a reverse Kegel, and I opened up the diaphragm and I let the air down below. And I actually felt the rectum release quite a bit. And then so out of curiosity, I decided I was going to now do a gentle Kegel. And so I squeezed, I clenched, and I felt the pressure around my finger get, again, exceptionally tight. And then so I just kind of stopped doing anything and just got into a more neutral position. And that's where I realized something. My neutral position was clenched almost as much as me performing a Kegel. And it was almost like having my finger there was representative of me seeing on a graph, okay, this is the strength of a Kegel. This is a reverse Kegel where it's completely open. And then the neutral, which probably should be closer to the middle, was way up here. And so, like I said, that was a game changer for me because I was able to take that information and then apply it to when I didn't have my finger up in there. It's almost like I had a clearer picture of the understanding of the tension of the muscles in my pelvic floor.
Wow.
And so taking this and now applying it while I'm standing at my desk working and typing an email, I would actually feel myself Kegel up when things would get stressful at work. I'd feel myself clench. And so I would then perform a reverse Kegel while I'm standing there working. And this was very important because it helped me understand the state of tension in my pelvic floor all throughout the day.
It's tight.
And as I felt it get tight, I could now have independent control over the state of tension in my pelvis. So what I like to tell the guys that I work with is if you're feeling tight, perform some reverse Kegels. If that's not working, stick a finger in it.
Stick your finger in it.
Okay.
And, I think that this is a helpful tool for neuromuscular re-education. And I want to apologize because I haven't released a video on any of the strengthening exercises that I've done. And here's what I want to say. I really want to make it. And there's a few reasons why I haven't. The first is my garage is a mess. The second is I'm feeling a little bit bloated.
Don't want to be on camera.
And the third and more important reason is that I think it's important that you watch these two videos. The trifecta one first, how to stabilize your pelvic floor, and then this one, and that you practice it. You practice bracing your core, you practice bracing your glutes, and you practice dropping your pelvic floor and relaxing it. Now, that isn't something that you want to take into the strengthening program. You don't actually have to do a reverse Kegel while you're, busting out some air squats or doing some glute bridges, which are some of the exercises that I'm going to be sharing in my next video. But it is more of being aware of how tight your pelvic floor is. Again, if you go into a strengthening routine and you're just bearing down and clenching everything up while you're doing things, I promise you're going to put yourself in a worse situation than you were. Things are going to get tight. You're going to have more nerve compression. Your symptoms are going to increase. Don't worry if that happens. It's not permanent. If you are already doing a strengthening routine and you are finding yourself clenching up, that doesn't necessarily mean you have to stop everything, of course, unless you're in severe pain. This is something that you're going to have to learn and adapt. You're going to have to learn how to drop those muscles, relax everything up while still activating other muscles. And that's the hardest part about this part of the recovery step. But I promise you, the more you practice, the better you'll get at it. And the best way to practice is doing the trifecta, bracing the core, engaging the glutes, and dropping the pelvic floor. All right, guys, I hope you found this video helpful. If you have any questions, leave a comment. I try to respond to everyone. And don't forget, we have our Discord community full of guys who are on their path to recovering from pelvic floor dysfunction. A lot of guys are seeing improvement just applying the principles that we discuss here. Please click that subscribe button. This helps the algorithms get the content out to folks like you who need to hear this information. And I am working on something very special to release in the next couple of months, so stay tuned for that. In the meantime, stay strong and keep it loose.